Hi, everyone. Thanks for joining us on another episode of Healthy Slice. And today we're looking at rest, sleep, and the new International Medical Graduate, or IMG. Now, I don't know about you, but in medical school, we were taught study techniques, how many chapters of material we should cover in a week, how many hours of experience that we need with different clinical procedures. But no one talked to us back then about our rest and sleep, which is absolutely crazy because the harder you work, the more important sleep and or even just breaks become. Lack of sleep is now known and has been shown to be linked to poor attention span, memory failures, decreased decision-making abilities, slower reaction times, and all of these things are critical in healthcare situations. Additionally, a lack of sleep very quickly can lead to burnout. Today, Dr. Shakil, a UK NHS consultant, is here with me to chat about the weird ups and downs and conflicts around sleep in the lives of medics, including IMGs. Welcome, Dr. Shakil.
Thank you so much, Alicia, and good morning from breezy, cold Manchester morning.
Yeah, when you should be in bed resting instead of out here. But thank you for your time. You're going to keep it nice, short, and fascinating so you can get back to your rest.
Thank you.
So Dr. Shakil, for those of you who, for those of our listeners who don't know you, tell us a little bit about your background as a UK NHS doctor.
All right. I'm one of international medical graduate.
Hmm.
Moved to UK in 2004 and completed all my training from junior doctor to the consultant in the UK. So I have been a consultant. I have been outstanding consultant. So I have been through all the PLAB journey, international medical graduates journey.
Yeah.
And after that, spending 22 years in NHS, moved into full-time education, where we're supporting, guiding, and empowering international medical graduates from Hive Medical Academy platform and Benfield's Professional Medical Education English platform.
And with that background, first of all, we should say you're an international medical graduate who came from Pakistan. Okay.
Yes.
So, because there are going to be lots of people from Pakistan also listening to this podcast. But that background that you just described means that you have a lot of personal experience yourself, pushing through long hours of studying, regular shifts, being on call. Thinking back to those your much younger days, what was that like for you? Both the positives and the negatives of it.
Yeah, that's true. And I'm still young.
Yeah,
I'm
that's
not
why I said
that.
that's why I said younger days, not young days, younger
Yeah.
days.
So the NHS was completely different. If you go back 20 years,
Hmm.
the international medical graduates coming from different countries, different healthcare system, the training system was completely different. We had a pre-registration house officer, then you had a house officer, and after that you had a senior SHO. The long working hours, nobody worrying about your breaks and sleep or rest or anything. You see patient, 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 work, work, and work.
And
And used to do the 7 night shifts. And if you're a medical SHO and you're on calls and you're running from one corridor to other corridor of the hospital, you're running from one ward to another ward all night. And if you're a few minutes late in answering the A&E bleep, the consultant will be saying, "Where are you on call, SHO? We have got two patients waiting for you to be correct."
I,
So it was a tough life.
yeah, it was. Where have you been? I've been calling you for 2 minutes. I've been calling you for 3 minutes. Why are you sitting down having a cup of tea? Have you collected the results for the patient on bed 6? Uh,
True.
I recall being a senior registrar on NICU, and you slept on the NICU. There was a little bedroom in the
Yeah.
back, and that was back in the day when you had the landline telephone, and the operator actually called you. So there was a phone at the bed side of the bed, and I would sleep there. But the thing about it is, I would jump up in the middle of the night and go, um, grab the phone. Operator, did you page me? Or rush out the door, stick my head out the door. Did somebody just knock on the door? To the point where I became a joke for the operators and for the nurses on the NICU because I was always firefighter ready. I never slept deeply to the point where after a while, I'd pick up the phone and the operator wouldn't even say anything, wouldn't even greet me. She would just go, Dr. Banfield, nobody paged you. Go back to sleep. Or the nurses would not look up from where they're writing on the desk and go, Dr. Banfield, nobody knocked on the door. Go back to sleep. Now, it sounds funny, but sometimes I'd be on call, what we call one and two. You do a 24-hour shift, do a regular, and then another 24-hour. And I would be like that for days. And looking back on it, it's a little anecdote, it's a little joke, but it tells you how so on edge I was, how not rested I was, and the fact that I wasn't getting any good quality sleep for days and days. And there are tons of doctors, international medical graduates in their home that are experiencing that. So Dr. Shakil, what are your perspectives on sleep deprivation?
I completely understand and I agree. And that reminds me another story which I will
Hmm.
share in a bit. Sleep is very important because sleep is directly related to your concentration and work output. Those days, yeah, they were tough. You're working 7 hours, 12 hours, 14 hours. And if last minute you get the arrest call, you're finishing at 7 o'clock, you'll end up finishing at midnight.
Yeah,
The beauty of our profession, after all long shift of 14 hours or 12 hours or 15 hours,
yeah.
when a patient or relative comes to you, say, thank you, doctor, you saved my mom's
Well,
life.
yes, yeah,
Thank you, you saved my husband.
yeah,
And they come with the card, they come with the chocolate, and sometimes they just say, thank you so much, you
yeah,
made my day.
yeah.
So your all tiredness, your all, exhaustion, everything goes away. You feel so happy, so peaceful. Yeah, I will tell you one of the story when I started my first shift as a medical SHO. First on-call night,
Hmm.
I had a bleep, and that was the biggest fear because that medical SHO bleep goes off every second, every
Yep,
other second.
yep, yep.
Calls from the medical wards, surgical wards, from A&E,
Hmm.
and everybody wants you immediately to come and review the patient. So I received a bleep from another hospital, which was step down hospital, and I said, "Oh, this is on-call medical SHO." I said, "Yes, I am." And okay, we have got the patient, and she sneezed, and after that, she dislocated her jaw. So I said, "What?" So, so I said, "Okay, you need to come and review the patient." So that was my first patient, first experience,
Oh,
dislocated jaw. Oh. I knew, I read about it, but never
you've never done
relocated the
it.
job.
Yeah.
Never done it before. So I went to my registrar and we had some discussion and read in the book because those days we didn't have any smartphones and search and do this
No,
and that.
no, you had to go to the book, the
Yeah.
physical book with
Physical
pages,
book. We used to carry the Oxford Handbook of Specialties in Medicine in our pockets.
or the Merck
So
manual. Yeah, yeah, yeah.
yeah, yeah. So he said, okay, yeah, this is where, and you go. So that hospital was a bit far away. We had to book a taxi and go to there and
Hmm.
went. And as soon as reached in the ward and asked the nurse for the notes, and she said, "Oh, doctor, thank you for coming by." She sneezed again, and her jaw is back to normal now.
Spontaneous reduction of a dislocated jaw. It just
That
needed
was,
another sneeze.
I know, that was a big relief for me as well. But this could happen to any
Hmm.
international medical
Yeah.
graduates.
Hmm.
One more thing.
Hmm.
The MMC, Modernizing Medical Career,
Yeah.
that brought a big, big revolution in the training system in the UK.
Yes.
But one thing still was missing, which was the enough support for international medical graduates.
Yeah. Yeah.
Everything has changed. Today's training for junior doctors or international medical graduates, they
Hmm.
enjoy it. They have the
Yeah.
luxury life, luxury training.
Yeah, there are
Honestly.
limitations on the number
Yeah.
of hours, the number of shifts they do back to back, the number of hours in each shift,
Yeah.
breaks for study leave.
Study leave, sick leave. Every 4 hours you have got 30 minutes break. One half day you get for your portfolio. One half day you have the teaching. You work 3.5 days in a week. And imagine somebody working 7 nights, consecutive nights, and after 7 nights, you don't go home and you don't recognize your family, and they don't recognize
And they
you.
don't recognize you. And the, but that's an actually extremely important aspect because sometimes I think um, the non-healthcare world, they consider healthcare professionals to be constantly going, constantly going. They don't realize that healthcare professionals, IMGs, doctors, nurses, they're humans as well. And yes, in healthcare, these professionals, we push ourselves farther and faster than most other professions or many other professions, but there comes a point at which your body, your physical brain just can't do anymore. And long before that, the standard of patient care becomes an issue.
Yeah,
Yeah.
yeah,
So it
that's
is
true.
good that with modernizing medical care, they have addressed that. And now all kinds of people, researchers, um, the legal field, insurance companies have now all weighed in and said, no, you have to get enough sleep. It is important. Yeah. And new IMGs coming in the system as well have so much going on. Yes, there's the work, but as you rightly mentioned, their family.
Yes,
They're settling their families into the UK. They're trying to get a new home. They're probably trying to get a car, or at least trying to figure out how to get
yeah,
around, how to interact with their neighbors, learning cultural things. And that's a lot of mental input.
that's so true. That's so
Mhm.
true. And doctors, nurses, healthcare professionals they're very special people. This is the one reason the public has got very high expectation from them.
Yes.
Okay?
Yeah.
So when MMC came, that evolved the NHS training and doctors training, everything. But for the IMGs moving from one country to other country, there was
Support.
still a huge gap in the sport awareness and
Yeah.
guidance.
Yeah.
So Global Medics, luckily, then Global Medics NHS program came.
Has
Yeah.
and is filling that void.
Yes.
Um, by providing so much information. And it's not just about your PLAB, your UKMLA, and your PLAB, about your OET and your IELTS. It's also everything from visa and immigration to settling in, cultural counseling, preparing a good CV that grabs the attention of recruiters, as well as employers. Uh, Give us a little bit more about exactly what is in the GMNP.
Yeah, sure. I would say the Global Medics NHS program is another MMC for international medical graduates. Like MMC brought the
Yeah,
revolution
yeah,
in this,
exactly.
yeah, yeah,
Yep,
yeah.
yep,
So GMNP is a life changer for international medical graduates. Any
yep.
doctor, any medical student, anywhere in the world. If they're willing, they're planning, they're thinking of joining the best NHS healthcare system, the best organization, which is full of benefits and rewards. Global Medics NHS program is the best choice.
We
From the day
literally,
one,
we
yeah,
literally hold their hands from
yeah.
day one, and not just until they pass the exams, but well beyond they get the support.
Yes, from day one, their everything, all exam preparations, their airport pickup, their visa documentations, their EPIC verifications, their clinical attachment, if they need CV review, their mock interview preparations, their hospital, where they could apply for the jobs. And after that, if they want to buy a house, they want to buy a car, they want to get married. They want need legal advice. They need anything. They will be the lifetime member of Benfield Professional Medical English and the Hive Medical Academy. What anything they need. So this will cover the gap for the IMGs. Like MMC fill the gap for healthcare
Training.
profession in the UK. And this
Mhm.
will GMNP is the same life changer for them.
For that. And this is great news for people who are IMGs who are coming from backgrounds where perhaps working conditions are still up to this day quite brutal. I mean, even in recent months and years, there's stories coming out of places like Nigeria and Japan and India of doctors working in conditions where they're working non-stop, not just for hours, but for days, sometimes for weeks, past the point of exhaustion, sometimes to the point of collapse and even death. So coming into the UK, they need to know it's a different system. There is more support, two types of support. There's MMC for your training, and
Yeah.
then there is GMNP, Global Medics NHS program that supports you in settling the rest, in settling all of your
Yeah.
life.
True. Very true.
So thank you very much, Dr. Shakil, for taking time to talk to us. Um, are there any key takeaways that you want to leave our listeners with, or you've hit the highlights already?
Yeah, I think any medical graduate anywhere in
Mm,
the world, and they are planning to have a better life, better training,
yeah,
and they want to enjoy the luxury training in the NHS
yeah,
Global Medics NHS program is the best, and
yeah,
we will hold their hand, and they could
and
enjoy
guide
their
them.
life. Yeah.
So that's it for this episode. Thanks for listening. In our next podcast, we are going to a slightly darker corner of healthcare, one some of you may have heard about but never experienced, while others of you may have experienced it and are still unsettled by it. And that is violence, corruption, and ethical conflicts in healthcare. What are some of the bad situations healthcare professionals can find themselves in, and what can they do when these bad obstacles stand in the way of the values and services they swore to provide for their patients? In our next podcast, our guest has worked around the world, at times in some very hairy and even dangerous locations. And he will chat about us, not only about his experiences, but how his career has survived and he is still standing today. So tune in for our next episode.